seen a decline, and according to behavior change communication managers Alberta Gordon Bosomtwe, the number of cases reduced from 30 to 22%. This, she said, is a result of measures put in place by the Ghana Health Service and its partners, including the Anglo Gold Ashanti Malaria Limited. The measures include indoor residual spraying and distribution of insecticide-treated mosquito nets. Rafik Salam reports from Wa.
The 2009 annual report of the National Malaria Control Program shows the disease is a major cause of poverty and low productivity. It accounts for about 32.5% of all OPD attendances and 48.8% of under 5 years admission in the country. The attempt to control malaria in Ghana, which began over 60 years ago, aims at reducing the malaria disease burden till it's no longer of public health significance. It also recognizes that malaria cannot be controlled by the health sector alone. Therefore, multiple strategies were being pursued with other health-related sectors. Anglo Gold Ashanti Malaria Limited, Agamal, in partnership with the Ghana Health Service, with support from the Global Fund, began the indoor residual spraying program in Ghana. It was first started at Obuasi as a pilot project before being replicated in other parts of the country. The aim is to kill or shorten the life cycle of the adult female Anopheles mosquito that transmit malaria parasites and eventually reduce the prevalence rate of the disease. After 6 years of operation in the Upper West region, a review meeting was therefore held for major stakeholders. Alberta Gordon Bosomtwe is a social and behavior change communication manager of Agamal.
Together with the other interventions that are going on, be it the indoor residual spraying being organized by Agamal, and then the distribution of the long-lasting insecticide-treated nets, the seasonal malaria chemo prevention, we are seeing a lot of successes in the reduction of the cases from over 30% to around 20-something, 22%, yes. And these figures are not mere figures, they are human beings. And so any reduction in the deaths of people is a big success story for us.
Despite the success chalked, the program is not without challenges.
You go to certain communities, and because of the farming activities, they are all away. If the people are not in the communities, we don't get access to the rooms to spray. And some too are having some misconceptions about the insecticide we are using. We have World Health approved insecticide. These insecticides have been approved by the World Health Organization for use in public health, and they are certified by the EPA.
She also spoke of measures put in place to ensure the safety of households, the environment, and spray operators. Reporting for Joy News, Rafik Salam.
And before we go, let's focus on education. And the Minister of State in charge of tertiary education, Professor Kwesi Yanka, says government will upgrade all under-resourced technical schools and colleges